You're hanging out with us right here on the Joint Force, and with us today is Army Brigadier General Mark Thompson. He's the Commanding General, Regional Health Command Europe, and the Command Surgeon for United States Army Europe. Sir, thanks so much for taking the time with us today. Welcome to AFN. Now, you took command of Regional Health Command Europe on July 10th. Can you talk a little bit about, who you are, your background, and how you came over here?
Sure. I'd really like to thank you for allowing me to be here today and speak with you. So I am an Army pediatrician and neonatologist that has been in the Army now for 30 years. Came here from Fort Bragg, North Carolina. My last job was as the Force Comm surgeon at Fort Bragg. My wife came with me. My wife, Kathleen, is 30 years. We have 3 daughters who are now all grown up and out of the house, which is good. So it's me and Kathleen and our dog, and we are very excited to be here in Europe and very excited to be taking on the challenges of running the healthcare system here in Europe for the Army.
Now, we hear you're a Michigan man. Our MC2 Hogan is also a Michigan man.
Oh, yeah. Go green, go white.
Go blue.
A little bit of rivalry.
Always different.
A little bit of rivalry today. Now, sir, Army Medicine is celebrating its birthday on July 27th. How does Army Medicine contribute to the overall readiness of our force here in Europe?
So I think the number one thing we do is we ensure the medical readiness of all of our soldiers here in Europe. I think the other very important piece that certainly we pay attention to a great deal is the readiness of the medical force. So our folks, our medical soldiers in uniform have to be ready to do their jobs as well. And so while our number one priority is medical readiness of the entire force, the ability of our medical force to do their jobs is number 2. Also, as everybody's very aware of, we are very focused on COVID right now, focused on the issues of keeping the force and our families and all of our retirees here in Europe safe and well taken care of, and trying to align our services, both medical and dental and public health, in this COVID environment so that we can continue to deliver care, but deliver care in a safe manner.
Awesome. That's Army Brigadier General Mark Thompson. He's the Commanding General for Regional Health Command Europe and the Command Surgeon for United States Army Europe. Keep hanging out with us, though, because we're going to be talking to the General coming up about what you can expect from military health care here in Europe in the next coming years. It's the Joint Force on AFN.
It's the Joint Force on AFN, and today we are joined by Army Brigadier General Mark Thompson. He is the Commanding General Regional Health Command Europe and Command Surgeon United States Army Europe. Now, sir, earlier we were talking a little bit about how you just assumed command of the Regional Health Command. What can we expect military health care here in Europe over the next several years?
So I think, as always, our job is to focus on the readiness of the force and the readiness of the medical force, and those will always be our priorities. In these new times of COVID, and COVID is really going to be around for, I will say, a while, at least the next several months, if not a few years. We have to learn how to deliver health care in that space now. With COVID as part of the equation, how do we deliver health care safe for our patients, but also safely for our staff? And so we're really working very hard to determine that balance. What type of face-to-face appointments do we need to have? What type of precautions do we need to take ahead of those appointments? What type of precautions do we need to take within the appointments? And then I think the big question we're working through is virtual health. How many of our appointments can we do via telephone or via some virtual health mechanism? We found in these last 4 months that we've been able to deliver a great deal of health care. We really had to deliver a great deal of health care via virtual means. And now, as we kind of come out of that bubble, we're beginning to analyze with our patients, which of these appointments do we now need to keep virtual?
Okay, sir. I think that's great. The virtual health is awesome, and I think Sergeant Greer, MC2 Hogan, and myself can really speak to the virtual health because we've had a lot of our appointments via Zoom meetings or phone calls, and we've actually really enjoyed them because of our location here. Mm-hmm. It's been a lot easier for us to be able just to talk to our doctor over a FaceTime call, really.
Yeah. And I guess a question for you then would be, though the way those were done, whether they are phone calls or through Zoom, did it meet your needs? Because one of the things we struggle with is people are always pushing onto us, hey, here's a great platform to deliver health care. And usually when we put that in place, the patients are like, no, that really wasn't very good. And it seems during this COVID period, we used what we had. We had Zoom, we had MS Teams if people were hooked up on the network, and the feedback from the patients was we loved it. And we want to continue to get that feedback from our patients because we don't need to spend a whole lot of time and effort on platforms that may or may not work when we have platforms that have been very successful.
Yeah, I think for us, we can say for the three of us that we've really enjoyed it now. MC2 Hogan, I think we got a little bit more for the general as well, right?
Yes, we do. Okay, so sir, how does Regional Health Command Europe ensure that service members, their families, and retirees are going to receive the best care possible in medical treatment facilities around Europe?
So first of all, again, during this period of time, we are 100% committed to providing absolutely the best care and the safest care we can to our patients, whether it's emergency care, elective care, or routine care. We had to reduce a number of our routine services during this COVID period of time, but we are slowly and very deliberately reopening our aperture for increasing medical services while continuing to assess that risk to both patients and staff. And so we're going to have some face-to-face encounters for both acute and chronic, but we'll continue to rely on virtual means, whether that's via telephone or via video chat, for some appointments as well, as we continue to use as much precaution as possible to reduce the spread of COVID-19. You can also, as always, it has always been available, you can secure message your provider via TRICARE Online, via the patient portal. And at the end of the day, I think what our patients should expect from us is the best care that we can deliver to them. All of our facilities are joint commissioned, gold seal of approval. Our providers do a great job. Our staff does a great job. I think they do a great job. But we also need to hear from our patients to ensure that we're meeting their needs, particularly during this kind of very scary period of time that we've been going through.
Absolutely, sir. I 100% agree. That was Army Brigadier General Mark Thompson. He's the Commanding General, Regional Health Command Europe, and the Command Surgeon for United States Army Europe. But keep listening to the Joint Force, because coming up, we are going to be talking a little bit more about maintaining our social distancing in the future.
You are listening to the Joint Force, and in the studio today we have Army Brigadier General Mark Thompson. He is the Commanding General, Regional Health Command Europe, and the Command Surgeon, United States Army Europe. Sir, we were talking about how telehealth has been a huge help for service members during this pandemic, but as restrictions continue to loosen regarding coronavirus, both on post and in host nation countries, do we need to continue to maintain social distancing, wearing our mask, washing our hands, etc.?
Yes, very much so. So I think it's very important to realize that while the incidence of COVID infection has dropped greatly in many of the countries of Europe, COVID is very much still present. And also there's a great deal of the new cases of COVID coming into Europe are coming from folks PCSing or rotating into the country. So COVID is still there. So how do we prevent the spread? How do we prevent us returning back to the point where we were several months ago? And the keys are exactly as you pointed out. One, we should try to maintain social distance. So yes, you can be out and about. You can go out to eat in a restaurant. You can go to the mall and go shopping. But you should absolutely try to maintain 6 feet distance from the other people you're with, other than your family members that you're with all the time. Two, if you can't maintain that social distance, you should be wearing a face covering. A face covering covering both the nose and mouth. It's important to remember we wear a mask not to potentially keep us from catching COVID, but prevent us from spreading COVID to other people if we happen to have COVID and are asymptomatic. And then third, something that the healthcare community has been preaching for years: wash your hands. Just like your kindergarten teacher would say, wash your hands. Don't touch your face, and if you touch something, wash your hands again. The hand hygiene is critically important. That is really how COVID is primarily spread, and washing your hands become really important. So doing those three simple things really keep the number of cases of COVID down and allow us to keep our communities open and people to go out and be able to enjoy the things they want to enjoy.
Now, sir, one of the things that we really enjoy here on the Joint Force is random facts and surveys. And we read one the other day that says the average American now washes their hands at least 16 times a day.
Yeah, and I can believe it. And I think, and even I look at in my particular medical specialty, where I take care of babies all the time, I'm washing my hands all the time. But I've noticed outside of the work environment now, I am much more conscious of, hey, I touched something, I got to wash my hands. And I think it's a very valuable lesson for all of us to know.
Thank you, sir. So I have to ask you, is there anything else you would like to add?
So I think just a couple things. So first, a quick public service announcement. Our armed forces blood drives have been working real hard to keep the blood supply up, and I know they get out and advertise quite a bit. But I think an important message to put out to the community, if you hadn't heard already, is that there had been quite a bit of restrictions on the ability to give blood for folks that had lived in Europe for an extended period of time back in the 80s and 90s. Those restrictions have been lifted, especially for those restrictions for folks that had lived in the continent of Europe. There's still some restrictions for those that had been in the UK or Ireland. But it's important that if you haven't been able to give blood in the past because you had been stationed in Europe, that might have changed. So please think about giving blood if you have the opportunity. Second, I think always really thank all of the audience out there for putting your trust in Army and military medicine. We do everything we can to take care of our beneficiary population, and we hope we're doing a good job. And if we're not doing a good job, or if you don't think we're doing a good job, we want to hear from you so that we can do better. So whether that's ICE comments, whether that's phone calls, we can't fix problems if we haven't heard about them. But also, if you have something good to say, particularly about a provider, a nurse, a tech, a corpsman, a medic that has been taking care of you and doing a good job, we love to hear about it, because those folks love to get that feedback to know that they're being appreciated for what they're doing. But it really, those would be the things I'd like to add.
Perfect, sir. Thank you. That was Army Brigadier General Mark Thompson. He is the Commanding General, Regional Health Command Europe, and the Command Surgeon, United States Army Europe.